Welcome to Newsmakers. I'm Lisa Oligas. In today's edition, we explore radiology as an area of study here at Missouri Southern State University. Joining us is Dr. Sherry Whiteman, current radiology program director and the interim department chair for Allied Health. Dr. Whiteman, thanks for being here.
Thanks for having me today.
So radiology as a department and a program, we want to talk about this. Many people assume radiology is x-rays. Yeah. It's a lot more than just x-rays, isn't it? What is involved in radiology?
Oh my gosh, radiology is imaging of any part of the body and through a various number of modalities. So we're talking about everything from a chest x-ray or an x-ray of your foot to ultrasound, like when women are pregnant and they want to know about the baby, CAT scans, where they look at you and it kind of does some sliced imaging to get a really detailed image of the patient at any part of the body. Same with MRI, magnetic resonance imaging, PET scans for diffusion and all those things. So it's imaging of anything you can imagine on the body.
So we could talk about each one of those a little bit more individually, but how has radiology changed over the years and with the new equipment we have? Because I know that I talked to radiation oncologists before and they said, you know, years ago, people who had radiation would go, I'm never doing that again. It seemed to be, it could cause problems.
Sure.
But now there's modern equipment that makes it a little more, I guess, safer in general.
Yeah. Oh my gosh. I mean, you know, when radiology and x-ray first came out, they used to drive around in like little ambulance trucks and it was a big to-do, and yeah, it was a lot of exposure to get the one image, but now it's so localized that we don't have to worry. We have machines that are energized to focus that radiation into the one spot, so we're not radiating an entire body. That means you can focus in on tumors in certain spaces and not have to worry that you're radiating something else and causing trouble somewhere else. The technology is unbelievable now. You know, ultrasounds now are handheld. They're handheld, where they used to roll around on big machines room to room. You can have old school x-ray machines that take up an entire room, and now maybe it's a part of a room and you can have a couple in that same space. You know, we have standing tables and laying tables and everything in between. So, I mean, we went from really big and not so focused to very small and laser focused, which I think aids to good patient care. You know, they don't have to worry about anything beyond what they need in their imaging.
Tell us about the equipment we have here on campus that our students get to use.
Sure. We have two energized, or technically one energized lab here at Missouri Southern, but it's two lab spaces. One is an older setup and one is a much newer setup. In our newer energized lab, we have both the laying down table and a standing table for imaging. That way students could really shoot x-rays if they wanted to in that space and learn on equipment that's just the same as what's at the hospital. I think it's also important that we have some older equipment because sometimes you go to spaces that don't have the latest equipment. Mm-hmm. It's really important for somebody who's coming out into the field to know how to use anything that they're kind of put up against. So it's important then that we have both types and students know how to work across all of them.
And there might be safety protocols then that are different for older equipment than new equipment?
Yeah, exactly. You know, some equipment doesn't require glass in between it anymore, and some does, especially some of the older stuff. You have to step away within so many feet or get behind a wall or a glass window to maintain safety, and some of the new stuff doesn't. For example, there's what's called a portable chest x-ray machine. Mm-hmm. You walk around with it, you roll it into the patient room, they position it over the patient, and then they step away and press the button, and there's your image. It pops up live on the screen, so we get to view it in real time, but you don't have to stand behind glass anymore like you used to.
You used to have those leaded vests for a lot of these situations.
Yeah, and they do still wear leaded vests in a lot of the facilities and a lot of the modalities, but not as much as what we used to have to.
Is it nice that then with this technology you can see the image pretty much immediately? Does that make a big difference in how we're helping patients and diagnosing patients?
Oh, it makes a huge difference. So for example, you have a patient who's in the ICU and somebody just put a breathing tube in. It's really important to make sure that that tube is in the right location. It's not too deep, it's not too high, and then it's in the trachea, not the belly. Well, so with that x-ray, that portable x-ray that pops up the image right away, as soon as the tube is put in, we step over, we look at the image, and we say, yes, that's in the right spot, or no, it's not. We make our adjustments, and there's no delay in care, which is really, really huge. And so we catch things much faster than what we used to, and we can make decisions much more quickly, which is huge when we're talking about sick patients.
Right. So let's talk about, you've brought some props with you. Tell
Yeah.
us about these props and how they're used in the classroom.
Yeah, so these are called
your lab,
phantoms. Yeah, these are called phantoms. I brought the hand and the foot here, but these the students can use to practice positioning for each image, because you can't just throw somebody's foot up on the screen or up on the table and just take the image and get what you want, right? If I want to see the ankle, I need to turn sideways. If I need to see certain parts of the hand, I need to position it appropriately. So phantoms like this not only let us point to specific structures as we teach, right? We can see the bones, but then we can talk about, as you position it, here's the image, I get an actual image up on the screen, and I can teach all live, all at the same time. And we have lots of these. We have a skull, we have a knee and a hip, and things like that, but these were the easier ones to carry across campus.
So they can be x-rayed.
Yeah.
And then you guys, now these don't show a broken bone.
No,
These are healthy.
These are healthy. These are healthy. So we wouldn't be able to pick up on those things, but it is really helpful because you want to make sure you always get the right piece of the structure in the image. So in using this, we can say, oh, you missed it here. This is the section, and they can see live instead of trying to look through the skin to say, oh, I missed that.
Excellent. So how, we say radiology has changed over the years, and so is the equipment. What all else is available for our students? Are they going to learn ultrasound here? Do they learn it in their clinicals?
So our program is focused on the associate degree of radiology or radiologic technology. So that's x-ray imaging, because that is the foundation that everybody needs before they can move on to the advanced modalities. So everything here is focused on x-ray imaging of every part of the body. So it's a 6-semester program because the body is quite complex. But once you complete that program, then you might be set up well to move into the specialties like CAT scan, MRI, or ultrasound. We don't offer those programs here, but we give our graduates a very solid foundation to be able to move forward into those.
And those are considered specialties?
Yes, they're considered specialties.
So what do you see differently from an x-ray to one of these other forms?
Sure. The other forms are just more detailed. So, for example, I can see an ankle break on an x-ray, but I might not be able to see, say, a clot that forms there or something deeper. So when we talk about CAT scan and MRI especially, it does very targeted sliced images of the patient, so I could get a lot more detail. And even some of those will let us do a 3D rendering of the patient. So I can, for example, a chest, let's say a chest x-ray, I can do the x-ray and all I can see is one part of that. If I shot it from forward to backward or backward to forward, I only see one view. But in a CT that's 3D rendered, it throws it up on the screen and I can spin the chest and see everything happening in the entirety of the chest. So where I might have fractures that are overlaid and I wouldn't see them in a standard x-ray, now in CT I can see all the fractures or anything like that. And so CT and MRI especially give us much more detail about what's happening in the body. So I almost feel like x-ray might be more of that first line intervention, you know, and then if we need more detail, then we can go into more detail. Ultrasound is often focused a lot on fluid movement. So again, it's focusing on different things like blood flow through the heart. We can tell how that blood moves and determine if there's anything blocking that fluid movement, which you're not going to see on an x-ray, because x-ray imaging especially is going to show you air and not much fluid, not as much fluid or blood flow. And so they just give us very different views of what's happening, which is helpful.
I mean, there's a lot of women who will get a mammogram,
Yes.
which is one version. Then they might go to 3D mammogram.
Yes.
And then if there's something they feel is suspicious, they might go to ultrasound and MRI.
Yeah, exactly. And that way we can just get very clear detail on what's happening so they get the best care possible.
So tell us a little bit about your own personal journey. I mean, have you been a radiologist in different kinds of settings? How was that for you?
Yeah, so I'm actually a respiratory therapist by trade, and I'm helping to cover radiology right now. We've hired a new program director. We're very excited to have her. But my experience with radiology is as a respiratory therapist. What they do for me is critical to my patient care. I need those x-ray images to determine if my tube is well placed. I need those CTs and MRIs to determine if there is a fracture that's going to impact how my patient's breathing. The PET scans and things like that will tell me about clots that might impact how my patient is getting oxygen to their body. So my journey with them is as a colleague, and I really see the value in the field because I can't do a lot of my work without radiology. In every facet.
It can really be important in not only diagnosis, but seeing progress, correct?
Yeah, exactly. You know, and sometimes we have really bad chest x-rays that we see, then that tells me what work I need to do. And then they come and tell me again, they do an x-ray the next day, and I can say, okay, that worked, that didn't work, and I need to reevaluate what I'm doing. So, I mean, and even with ultrasound, you know, it can tell us problems that are arising either with blood flow in the heart or even with babies that we're watching. If we're watching pregnant moms and waiting to see what's going on with the baby, those ultrasounds can even give us a heads up about what to prepare for when the time comes. So
it's pretty exciting developments, especially so much of it is in real time.
Yeah.
Whereas back in the day, it was,
Yeah.
we took a picture, we've got to go develop those
yes,
x-rays.
Yes, and we still have some of those
Really?
in our department, and they're valuable in their own right. But yeah, it used to be you take the image, it goes back, it gets developed, and maybe in 3 hours or an hour you get to see. But now the live is amazing. I don't know what I would do without it. Yeah.
It's that real-time imaging.
Yeah.
All right.
Yeah.
Well, we're going to take a little break
Okay.
here, and we talked with a few of the students in the radiology program. We're going to take a listen for their perspective.
Who wants to do an upright knee?
So I decided to go into radiology because I'm fascinated with anatomy, and I think it's a great way to still have that patient care aspect, and I think it's very versatile. You aren't limited to one modality, and I just think it's one of those things that will always be around. You'll always need it, and I always just knew I wanted to be in the medical field.
I didn't want to have to go for 8-10 years to go be a doctor, but I always knew I wanted to be somewhere in the medical field, and radiology was just one of those things that kind of combined all my fascinations of different parts of anatomy and that kind of hands-on interaction with patients, and it just kind of made for a perfect storm.
Aseneth and Nick are experiencing their first year in the radiology program at MSSU. It's a program that combines lecture in the classroom with Wednesdays in the lab. Here they become patients and technicians using real-world equipment to learn their craft.
I think the hands-on experience is crucial to what we're doing here as a radiology tech, or at least that's what we're learning to do, just because our profession is very hands-on, and you have to understand that there are so many, like there's a wide spectrum of circumstances you might be put under, and an even larger spectrum of people that you'll encounter. So just understanding how to deal with the patient and their situation and still get the image that we need.
Well, it's definitely helped me excel in my learning. I mean, if we didn't have labs, I don't think I would be as prepared to do my clinicals as I am now. If I didn't have the labs, it would just kind of all just be words that are spewed out of somebody's mouth.
Clinicals are twice a week at local hospitals, where the learning has yet another level of real-world application.
Being able to explore the different areas like MRI and CT and nuke med, ultrasound, all the different modalities and stuff like that, it makes it a lot of fun.
I really like being in the hospital setting. I like that hands-on learning environment, and then I also just like that interaction you get with the patients and just the real-life experience of what it would look like if you were an employee at that hospital. So
It's an education they didn't have to go far to find.
Missouri Southern was just really close. I live like 15 minutes away from the school. Compared to a lot of other options in the area, it's fairly cheap while still maintaining a good quality education. I definitely think one of the benefits of going to a smaller school is you have more of a relationship with students and professors as well. You don't get kind of lost in the muddle of a lot of different people, like 100 different people in a classroom or something like that. I think we have maybe 14 students, so it makes it really easy to maintain a relationship between each other.
I chose Southern just because it's local and it kind of checked all the boxes that I needed for my personal situation and just the fact that I'd heard really great things about it. Yeah, so like,
Wait, it's Don Julia's
Right now,
skull that's
Prepare for two.
prepare for two. You should be prepared for all.
Hey,
smile.
Time-wise, no, I understand.
Yeah, time-wise, it's
Also grading wise, because like
this is what.
when we
this
take
is
our
what-
typical lab, like we're graded over like the two positions that we do, but those are related to each other.
We're back and talking about radiology as an area of study at MSSU and the new technology that can give students real-world training. We continue our conversation with Dr. Sherry Whiteman, the current radiology program director. Welcome back.
Thank you.
So let's talk. Our students mentioned clinicals, and it's an important part of their education. It's them going to hospital settings. Where do they go? Where do they get their practice?
Yeah, so clinical is huge in healthcare programs, and I really think it's the best part. I think that's what sets us apart from other training in any of the other fields, really. Healthcare special that way. So our students go to Mercy system, Freeman system. So we do Freeman Joplin, multiple sites. We go all the way out to Stone's Corner. We go down to Freeman Neosho, Freeman East, lots of the clinics. At Mercy, it's the same. We use lots of the Mercy clinics around town in Joplin, and our students rotate through all of the options at both facilities. But they also go down to Mercy Rogers. We have a affiliation with Mercy Rogers, and we've been talking about adding some other affiliations just to expand their options. So clinical is so important because I'm training you to work on real people, and what's the best way to make you work on real people is to let you work on real people. So the students go to clinical and they're watched with a preceptor. There's always somebody with them.
So they're not left to fly solo
No,
on their own.
never.
Don't worry, patients out there. It's okay.
But the whole point is that they get real life practice, because while we can practice with these types of devices, they're not real. And not everything is perfect in real patients. So they go out to clinical at least 2 days a week, 8-hour shifts, and they're doing real competencies on real patients. That number grows as they go through the program because we know the value of working in that real space. My goal is always to make the best practitioner I can make. And so by giving them those opportunities in real spaces, then I know they're going to be great to take care of your family or my family because they've trained in real life.
So one of the things the students even mentioned was the idea that they get to work with different personalities in patients. How important is that in the education of someone who's going to be in healthcare?
Oh my gosh, it's so important because everybody is different. There are days where we have difficult patients, but maybe they're going through something really hard, and I can't train you for that very easily without just having you have that experience. So they're learning to work with a preceptor, they're learning to work within a department atmosphere, and they're learning to work with patients who may or may not be ideal. Sometimes they follow instructions perfectly, and sometimes they don't despite their best efforts. And, you know, we use simulation sometimes for those experiences, but what better way, again, than to do it with somebody who's real? So
But these are people who are in pain sometimes.
Yes,
so
exactly.
Are there certain techniques when you're teaching someone how to x-ray to, I guess, do the least harm when you're trying to position someone, say they might have a broken arm, leg, anything?
Yeah, exactly. And so all of that plays into account into how they position the arm and trying not to hurt the patient. So if they have hurt their hip, I don't want them laying on that hip. I'm going to try to, position them in a different way to still get the same image that I need. And working with that and with the patient is valuable experience. Communication is so important in what we do. That's one of the things I need to practice the most. So
I know I've had some x-rays done because of hips and knees, and some of them are done standing, which you used to think, oh, everybody lays on a table.
yeah.
How is that? Does it change things, improve things? Does it make it better for the x-rays?
I think it makes it better because, as you had mentioned, like weight bearing versus non-weight bearing, you're going to see once somebody stands how that joint shifts, which is going to tell the physician a lot about what needs to be changed or fixed. And so being able to do both of those is important. That means the student needs to know how to position the patient while standing and laying, how to coach them through all of that, because, you know, some patients just, for example, some patients have dementia and they will try their darndest to follow instructions and they can't. And so learning to get the right position during difficult communication, you know, that's really important as well. And so all of those, it's not just a one and done. It's not just I shot it from the front to back and that's it. It's very much tiny tweaks of the hand and the pelvis or whatever to get the image that you need.
One of the students said he was excited about clinicals because that's when you then get exposure to all those other modalities,
Yes.
Such as the MRI or the CT scan. And that's big equipment that hospitals, you know, it can be millions of dollars in equipment for them to invest in. Tell me some of the uses, like what would a CT scan show someone?
Sure. So a lot of times patients who have been in a motor vehicle accident will go for a CT scan because we want to be able to identify any breaks in any of the bones, any other areas that are lacking. So as a respiratory therapist, I want to know, is there air where there's not supposed to be air? And so my CT scan can help me identify all of those things. MRI would be the same thing, again, just more detail, even more detail. And so we do those as we determine severity of illness,
And
if that makes
some
sense.
of those, I know they always say like stand still, or
Yes.
sometimes they want you to take a breath. What is the difference there? And I know that like the one they say, oh, you're going to go in, you can't move for a long
Yes.
time.
Yes.
Why is that? Tell us why, you know, because a lot of people think, why can't I just let go and
Yes.
breathe? Or
Yes.
why do they tell me to hold my breath?
Yeah, because all of those things give us different pieces. So the holding your breath, right, is typically for anything related to the lung. Well, I want to see the lung in full expansion. So I need you to take a big deep breath and hold and don't move because just like with a camera, right, if somebody moves, you get that blurriness, and it's the same on our imagery. And so I need you to take a deep breath so I can see if you're expanding well or not expanding well. On MRI in particular, MRI is typically a longer procedure, but it's doing micro slices of the body, and any movement blurs the slice. So because it's giving me such detail, I need them to hold still for a really long time.
So when we think about like you're in, I think it's an MRI machine where it seems to be like circling you.
Yeah.
And is it taking multiple images? How is that? And then how does that print out for you all, for those folks to read?
Yeah, it's so hard to describe unless you just see one. I wish I could show you one, but yeah, so the imagery is going around the body and giving an entire image around the body. And so when I say slices, it's like somebody has taken a section out of my middle and just pulled it up. And so if I were to look at one slice on that, it would show maybe my belly and my spine and my liver and all those pieces in this one slice. And then I move another centimeter and there's the next slice, and then another centimeter.
Very detailed.
Very
And
detailed.
gives you a big
small
picture.
slices. Yeah. So where I might be looking for a specific tiny dot in one location, I can find it because it did these micro slices of the human body. If that makes sense, yeah.
Let's talk about the different careers that students might have by studying radiology and how they might apply what they're learning.
Yeah, so application is key in all that they do. So when we're training them, we rotate them through as many sites as possible. Job careers are everything from working at a clinic, at a local physician's office,
Sure.
to working at Freeman or Mercy in the main department. But within the main department, there's still X-ray imaging, CT, MRI, PET scans, ultrasound. They can go into surgery actually, and they help in that area, taking images while the physicians do their work to make sure everything's right.
Right, because there's a lot of heart surgeries now that are,
Yeah.
it's less invasive.
Yes.
They go through the veins, but you have to see where
you are.
where that might be going to, and they operate in the heart even.
Yes.
TAVR procedures through the aortas. It's amazing to see, but it all has to be visualized.
Yeah.
Through either ultrasound or something else.
Yeah, and so even in cath lab where they do a lot of those procedures, there's somebody there pressing the pedals and pulling at the images to help with to help them see what they're doing, so we do the right things.
And then they can specialize. So,
Yes.
like someone maybe who is a mammography specialist,
Yes.
that would be an area of specialty.
Correct. So you can do there's so many, it's hard to remember them all. So yeah, mammography is one, ultrasound, especially in OB units or at the hospital, or ultrasound of any kind. There's lung ultrasound and heart ultrasound. CAT scan is a specialty. MRI is its own separate specialty. You can work on mobile units. So there are still mobile x-ray units that travel around and take images, for example, at a nursing home.
Okay.
They'll go and they'll do x-ray imaging of the patients and then take it back. So even those physicians can still see what they need to see.
Well, and there's a lot of this needs to be done with like athletics and,
Yes.
and sports injuries.
Yeah. And so you can just specialize in almost anything I can think of that would be
Right.
related to getting an image of the body. You know?
Which is excellent, because then if somebody wants to work with babies,
Yes.
that can be their niche.
Yeah.
But you can also then work in an ER, and you're going to have everyone.
Yes, exactly. Yeah. In the NICU especially, they're coming in, they're checking for holes in the heart, and they're looking for anything wrong maybe with the belly, because some newborn babies have troubles with their belly. So they're looking for those things, and it's hugely important in ER. In ER, you might be doing everything from ultrasound to CAT scan to
all of the
X-ray,
above.
all of the above. And so, yeah, just anything you can imagine.
So as we wrap up, tell us the length of study for our students, because the students we talked to were sophomores, but they're in their first year
Yeah.
of the radiology program. So what is the length of study that they have?
Yeah, so the radiology program is an associate degree. It's 6 semesters. So we go summer, fall, spring, summer, fall, spring. Now, to enter the program, you have to have A&P 1, A&P 2, English 1, Math 30, and then there's a med term that you can take in your first semester. So if you have dual credit, you can come in very early after high school into the program, but a lot of people need that first year of college to get their gen eds and get their prerequisites done. Then it's a 2-year program after that, 6 semesters. The beauty is we have a bachelor's degree that's set up where it's not long after that and you can earn your bachelor's degree as well.
Excellent. So it's a well-rounded program.
Yes.
All right. Well, we encourage anyone who's interested to give MSGSU a call. Dr. Sherry Whiteman, thank you for being our guest.
Thank you for having me today.
Thanks. Well, that wraps up another edition of Newsmakers. I'm Lisa Oligas. Thanks for watching.